If it seems like every other person you talk to has COVID right now, they just might. The summer surge of the disease is fueled by three new contagious variants. But there is some good news. This week, the FDA signed off on an updated COVID-19 vaccine from Moderna and Pfizer, which will soon be available nationwide. Here with us now is infectious disease specialist and senior scholar at Johns Hopkins Center for Health Security, Dr. Amesh Adalja. Dr. Adalja, nice to see you again, sir. Thanks for joining.
Thanks for having me.
With the updated vaccines, how will this help in the overall fight to stop the spread of COVID that we are seeing spread so rapidly right now?
Well, the problem with the vaccine prior to the one that was just approved was that it was no longer matched to what was circulating. So its ability to prevent infection wasn't very durable. And these new vaccines are matched to the variants. So this is likely to give you more protection than the prior vaccine. And certainly for those individuals who are at higher risk, it's going to provide protection against serious illness, hospitalization, and death, which is what we're really trying to focus on when it comes to COVID-19 as an endemic infectious disease.
During COVID-19, you and I spoke a lot about what was going on in this country. We spoke about side effects with those vaccines. What about this version? What are some noteworthy side effects we should be talking about?
They're basically the same as what we've seen in the past. So you can expect to have a sore arm, muscle aches and pains, maybe some fever, feeling fatigue for a day or two. That's what the majority of people are going to face with this or any other COVID vaccine. The serious side effects like myocarditis, not likely to happen very frequently with this vaccine because that was really tied to the two-dose schedule. That this is no longer a two-dose vaccine for people who've already been vaccinated. So I think it's really just the standard muscle aches and pains, fevers and chills that you may get after the shot.
And we're talking about the high numbers of cases in our country. The CDC says very high levels of COVID-19 were detected in over 30 states, 11 other states having high levels. There's a good graphic the team made up just showcasing the states that are being affected. Why are we seeing a larger increase this summer, Doc?
It's likely a combination of multiple things. As you said, there's new variants that are out there that are circulating that people have less immunity to. It's hot. People are going indoors where the virus spreads more efficiently. People travel more in the summer. And we've seen these summer increases every summer that this virus has been with us. Why it's a little bit higher this year may have to do with the nature of the variants, that they're more immune evasive. But it's important that when you look at that map, you realize that it's not translating into hospitals in crisis. It's not translating into massive numbers of deaths, which is because there's immunity in the population against serious illness. It's because we've got tools like Paxlovid and other antivirals, and it's because of the knowledge that we have. And that was the goal, was to decouple these cases from hospitalizations and deaths and make COVID more manageable. So even though that map looks all red, it's a very manageable infection compared to what it was 2 years ago, 3 years ago, and definitely 4 years ago.
Absolutely, and we're certainly seeing that in our hospitals. Now, despite the vaccine, we all know there's still a likelihood I might catch COVID, somebody else might. How do we protect ourselves? Do we go back to wearing masks and social distancing?
It's all really about individual risk tolerance. This is an endemic infectious disease. You cannot avoid it. It's part of the human condition, just like all the other respiratory viruses. But if you're trying to avoid it, wearing a mask when you're in crowded, indoor, congregated places makes sense. If you're high risk, making sure you have a plan to get Paxlovid is important as well. But each person is going to have to approach this a little bit differently. But certainly for the high risk, they should be aware when cases are high in their community that they may need to take extra precautions to keep themselves safer. But again, this isn't going to be one size fits all. Each person has to figure out the best way to navigate. But thankfully, we've got lots of tools that science and medicine have given us.
To that point, new research shows that long COVID looks different in kids than adults, especially when it comes to different age groups. Why is that?
Well, children are not little adults. That's kind of a cliche that we say, but children sometimes present differently. Their physiology is a little bit different. Their immune system is a little bit different. The way they complain about certain signs and symptoms may be different. But with long COVID, it's very nebulous still. We're still scratching the surface. It's probably, not one thing. Long COVID is an umbrella term that probably encompasses 3 or 4 different conditions. And we really need to unravel long COVID a lot more before we can actually say anything definitive or really useful. But yes, children can get long COVID. It tends to be rare, and it may not be exactly how an adult presents with long COVID.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.